Welcome back to Fox 12 Now. I'm Greg Nibbler, and thanks for joining us. An upcoming documentary that you can see will address medical concerns that I think is something that a lot of people have, whether you're watching us now or any other time. Navigating the medical industry is certainly something that can be challenging for anyone. Well, Will and Kristin, our guests, you may know them from Dr. Glaucomflecken, actually have a film just about this, about what it takes to navigate it and looking at it from also a medical provider's perspective as well, and some of the frustrations from their end. So we had a conversation about this just to go through what it means and also to let you know about the film that you can go check out yourself. Here they are on Fox 12 Now. Thank you both for joining us here today. Really excited to talk about, this documentary and what it means for so many people out there who have gone through a lot of things when it comes to the medical industry. But to start off, would you mind, just introducing yourselves and letting us know a little bit about each of you and what it is that you do in case people don't know, because I know you've got quite a following.
Sure. I'm Will Flanary, better known as Dr. Glaucomflecken. I am by day a comprehensive ophthalmologist practicing in the Portland, Oregon area. And then in my free time, I make social media, like medical comedy content.
Satire.
Yeah. Comedy content. It's hard to describe exactly what I do, but
He sits in this room alone and puts on costumes and records himself. Is what it is.
Yeah.
Essentially.
There we go. That's
And I'm Kristin Flanary. I'm his wife, but I also run the business that we have made around the silly little hobby that he has had, and along with I've been there for every step of the way for medical training, and then also for his patient journey as well.
And talking about that journey, that side of things, could you let us know, how does one go from a doctor to putting on costumes, in a room and doing all of this? Like, what's, I guess, the origin story of that?
Yeah, so it really, took off during the pandemic. So I have a background in stand-up comedy, and I've always, tried to continue doing comedy any way I can. And so once I got into medicine, it became a little bit more difficult. But then with the pandemic, I had, a little bit more free time on my hands. And so I started making these medically themed comedy shorts on TikTok. I discovered TikTok. And the feedback I got from physicians, around the country was that, it just felt good to laugh at the end of a really long day taking care of patients in the pandemic.
I think it made them feel seen,
Yeah.
made their issues and their pain feel seen and validated and shareable with the people in their lives in a very approachable way. And I think that was really meaningful.
And I just kept going with it, and it's grown to what it is today.
And it is. It's relatable. It's something that, as far as everybody's had some kind of experience. I feel like, whether it's themselves or someone else going through the process of whatever issue they have when it comes to the medical industry. So, talking about this documentary, can you give everybody? I know I keep asking for descriptions, but it's really fascinating hearing it from your own words. How it is you decided to make this, and what really it is you were trying to capture and relay with this.
Yeah, so the documentary is Suck It Up, Buttercup, and it's we were happy to just take a part. There's a big group of people, wanting to bring this issue to light, and we were happy to be a part of it, just to shine a light on really the abuses of the medical system, toward medical professionals, physicians, that's leading people to think about leaving medicine altogether, this thing they love so much, and the challenges of trying to practice medicine, do what many of us feel like we were born to do, which is to take care of patients, and the challenges that we face trying to do that in the U.S. healthcare system, and the strain that puts on us as physicians, but also
Also on patients and
yeah.
families. The way the system is set up is not designed for any of the humans working in or interacting with that system. And that is a topic that we try to talk about a lot, in his skits, on our podcast, anywhere that people will listen. We try to really shine a light on how it is that the healthcare system actually works behind closed doors.
Which of any industry or thing out there, probably one of the most important things if you're going through something like that, whatever it could be, is that human interaction. Like, if you're going through the most personal thing you could possibly go through, some of the healthcare scares that people may have or some of the things they're going through, yeah, you want to talk to somebody, not through, an automated system or something like that, whatever that may be. And so I think that's very interesting, though, also hearing it from your perspective. And, what are you think the biggest things that people should know, or that you think issues that should be tackled when it comes to that? And I know that's a very broad question for probably some very intricate answers, but.
Yeah, it's a great question. There's so many things that just put pressure on us that get in the way of cultivating and nurturing that patient-physician relationship that's so vital to what we do. And specifically, just the corporatization of medicine is a big part of our platform, and what I talk about on social media for years now is just the vertical integration of insurance companies, and we have Mark Cuban as part of this documentary as well, and the work he's done with talking about pharmacy benefit managers, which are now owned by insurance companies. Insurance companies also own pharmacies, and this vertical integration that's really taken a lot of power away from the people that actually do the work of healthcare and taking care of patients, and has placed the emphasis on really the wrong things. And so I think a big part of making this better is breaking that up, and turning insurance companies back into insurance companies again, reforming the prior authorization process, and shedding a little bit more light on the inner workings of insurance companies, because they want things to be a little bit more shrouded in mystery. So we don't really know the inner workings and how they decide, which claims are denied and how they deny those claims. And all of these things delay patient care. They put more administrative burden between doctors and patients, and
even affect the care that doctors are able to give to patients sometimes, and sometimes that costs lives.
Yeah, that's horrible. When you're talking about the film itself, and putting that together, I guess, can you walk people through, what to expect when they're watching it, as far as what's going to be shown? Clearly, some of the things that you're talking about, but just the film itself.
Yeah, it really tells the stories of physicians, patients, family members who have been affected by the way that the healthcare system is set up for profit over people. And it talks about, physician well-being and a mental health crisis that is really rampant right now in the United States among our physicians. And it just really tries to bring a human light to the things that are going on in this very obscure, kind of hard to understand system, to really make it simple for people to see how it works and what's going on and the effects that it has.
Storytelling is so valuable, really in any industry, but particularly in healthcare, because there are so many human stories. And so you'll see firsthand accounts, and you'll hear those stories, and I think that's what really makes this documentary resonate, and it makes it so powerful. Is you get that not only inside knowledge from people working in the healthcare system and living in the healthcare system, but also from the patient side, and how everything impacts that.
And it leaves you feeling like a little hopeful. I mean, it's heavy, and it talks about some heavy things, but it's also highlighting the power that we have when we work together, and when we have the knowledge about all of this to be able to affect change.
And a few of my skits make it into.
Yeah, I think so.
You'll see a little bit of that social media content as well.
Nice. So, I mean, it sounds like well-rounded as far as covering all those different stories, and like you mentioned, the healthcare industry, for those of us especially who aren't in it, it can be very confusing as far as how all of that works. And that's not a, revelation that other people haven't come to, but I'm like, to be able to see, and have some kind of an insight into that, I think would be really great. And it sounds like that's one of the things that you're covering on that. Well, for people who want to, see the documentary, who want to, who want to see this, can you let us all know, when, where, and how they can go about that?
Yes, so May 31st, the Tomorrow Theater in Portland will be doing a screening. We will be there doing a little Q&A also. So I think a lot of healthcare professionals will be there, but anyone is welcome to come on out.
Fantastic. Yeah, Tomorrow Theater's a great little theater too there for what is there in Southeast Portland. It's a pretty amazing work what they've done. So awesome place to be having an event like that and to have that interaction. Well, for you two, is there anything else that's really important that you think people should know?
You know, I think just from a broader perspective, a lot of the things we're fighting back against are these big corporate interests, and it's not going to be just an individual effort that's going to make change happen in the healthcare system. It's going to be a lot of work, a lot of people coming together, physicians, other medical professionals, patients, and it's going to be it's a big task to try to make this system more human and work for patients and medical professionals. And it's gonna, it'll be a concerted effort to make that change happen, but we can make it happen. It can, and I think the first step is making the public aware of this is what it's like. This is what it's like for us to try to do our jobs and for patients trying to seek care.
Yeah, and I think from the patient side, a lot of people don't realize that it's not the doctors setting the prices. It's not they interface with the doctors. They see their doctors, but a lot of what ends up happening within the system is not actually in the control of the doctor. And so to be able to see the inner workings and who actually is in control and what their motives are, what they're incentivized for, is pretty enlightening.
Yeah, I love that. Yeah, more transparency and understanding of how all that works is fantastic for everybody involved. Well, thank you both, for having time to talk to us here, and congratulations on the film and everything that you're doing, but also, getting the word out there for the message that you're conveying to everybody, and allowing somebody to see, a little bit more of how this all works. And as you mentioned, you'll be there at the Tomorrow Theater. And so thank you both for joining us here on Fox 12 Now. I really appreciate it.
Thank you.
All right, big thank you to both of them for joining us. Just to clarify too, it's May 31st when that film is going to be showing, and we will have that this interview up for anybody to watch afterward too. But May 31st at the Tomorrow Theater from Portland Art Museum. So a great place to go see that, and thanks to both of them for joining us here for that segment. We've got plenty more for you. We are heading towards our 4 p.m. news. We're here every weekday. We start at 1 p.m. We go throughout our afternoon. So let's take a quick break. We'll come back and continue on with Fox 12 Now.